If sacroiliac joint pain makes every night a battle to sleep and turns simple activities like sitting or standing into painful challenges, there is a way out. We've already helped hundreds of patients with SI joint dysfunction finally sit, sleep, and stand without pain, and now it's your turn. Our proven approach has allowed hundreds of people reclaim their lives, like sitting at their desks, standing on the job, or even sleeping through the night without the constant sharp ache of SI joint pain. Imagine getting through your entire day, work, rest, and sleep completely free of that exhausting discomfort. You deserve to live pain-free, and we're here to help you achieve exactly that. In this video, I'll walk you through my 3-step ergonomic plan designed specifically for those with SI joint pain. You'll learn how to adjust your sitting, standing, and sleeping habits to eliminate pain and take back control of your comfort. You'll begin to notice a reduction in pain within minutes of just adjusting how you sit and stand, and experience even greater relief after your very first night of improved sleep. Welcome to World Class Chiropractic's official channel. I'm Dr. Peter Turner, one of the dedicated chiropractors at World Class Chiropractic here in Ellicott City, Maryland. Our mission is to help you achieve your health goals, whether it's reducing pain, improving mobility, or enhancing your overall well-being. Before I dive in, be sure to subscribe to our channel if you want expert tips, effective strategies, and practical guidance to help you live a pain-free, healthy, and fulfilling life. When the sacroiliac or SI joint isn't functioning properly, whether that's due to inflammation, irritation, or instability, it can lead to significant discomfort in everyday activities like sitting, standing, or sleeping. The reason SI joint dysfunction can make even simple movements so painful is because the sacroiliac joint connects the sacrum at the base of your spine to your pelvis. It plays a key role in stabilizing your lower body and evenly distributing weight, which is why any issues with this joint can cause significant discomfort. When the SI joint becomes inflamed, irritated, or dysfunctional, it often leads to significant pain during common activities like sitting, standing, and sleeping. Sitting, especially for long periods of time, puts direct pressure on the SI joint, which can lead to irritation and pain, especially if you're using soft seating or maintaining poor posture. Now, when we're standing, the SI joint helps stabilize your pelvis, but with dysfunction, it can throw off your balance, forcing the joint to carry an uneven load and causing discomfort. Lastly, certain sleeping positions can twist or compress the SI joint, worsening the inflammation. Without proper support, uneven pressure can build up, leading to pain and stiffness when you wake up. With SI joint dysfunction, the ability of the SI joint to stabilize and absorb the weight is compromised, making pain more likely with any improper positioning. And that's why with this 3-step ergonomic plan is crucial for providing targeted relief, ensuring your SI joint remains supported whether you're sitting, standing, or sleeping. If you're dealing with SI joint pain, sitting can be a real struggle, but don't worry, I've got some easy strategies to help you sit more comfortably and relieve that pain. The first step is to choose the right chair. Look for one with good lumbar support or add a small cushion behind the lower back to maintain that natural curve of your spine. You also want to make sure that to use a firm seat cushion to keep your pelvis balanced. Soft tissues can make things worse by allowing your hips to tilt unevenly. Proper posture while sitting is key. You want to sit all the way back in your chair to keep your back fully supported, and you want to make sure that your pelvis is in a neutral position. That means no slumping forward or arching too much. Lightly engaging your core muscles can also help support your lower back and reduce pressure on the SI joint. You want to make sure that your feet are flat on the floor. Avoid crossing your legs. Whenever you cross your legs, you can be putting uneven pressure on your SI joints. Another important thing to make sure of is adjusting your chair height so your knees are level or slightly lower than your hips. That helps distribute weight evenly throughout your pelvis and keeps your lower back in a comfortable position. Sitting for long periods of time can be tough on your SI joint, so be sure to take breaks every 30 minutes. Stand up, stretch, move around to keep those joints from stiffening up. Even small movements can make a big difference in relieving that pain and tension. Now, if you're struggling with SI joint pain, standing for long periods of time can also be pretty uncomfortable. But with a few simple strategies, you can relieve some of that discomfort and stand more comfortably throughout your day. First thing you want to do is make sure to distribute your weight evenly between both feet. It's tempted to lean on one leg or the other, but that can put extra pressure on your SI joint. Keeping your weight balanced helps reduce the strain and keeps your hips more aligned. Next, we want to focus on maintaining a neutral spine, standing up straight with your shoulders back and chest open. We want to avoid tilting your pelvis forward or backwards. Keeping it in a neutral position is key to reducing that stress on the SI joint. If you stand for long periods of time, try using a footrest or placing one foot on a small elevated surface, like a low stool or a step. Alternate feet every few minutes. This simple trick can help relieve the pressure on the lower back and the SI joint. And be sure to lightly engage your core muscles when you're standing. This provides extra support for your lower back and helps keep your posture in check. Now, this doesn't have to be a full-on ab workout. Just gentle engagements can make a difference. Lastly, remember to take movement breaks. Shift your weight or take a few steps. Do some light stretching every 20 to 30 minutes. This prevents stiffness and keeps your SI joints from feeling too tight or sore. Now, lastly, if you're dealing with SI joint pain, getting a good night's sleep can feel like quite the challenge. But with a couple simple adjustments, you can find some relief and wake up feeling much better. One of the best ways to sleep with SI joint pain is to lie on your side with a pillow between your knees. This helps keep your hips aligned and takes the pressure off the SI joint. Make sure the pillow is thick enough to keep your legs parallel. This is going to prevent the top hip from rotating forward, and it will reduce the strain on the SI joint. Now, if you prefer sleeping on your back, try placing a pillow underneath your knees. This helps keep your spine in a more natural position and helps maintain the curve of the lower back, reducing pressure on the SI joint. You can even add a small pillow to the small of your back to add extra support. We want to avoid sleeping on your stomach as much as we can. This position can cause your lower back to arch too much, putting extra pressure on the SI joint and potentially worsening the pain. Sticking to side or back sleeping is going to be your best bet for the most comfortable night's sleep. With this 3-step ergonomic plan for maximizing comfort while sitting, standing, and sleeping, you can finally get through your day without pain and enjoy a restful, uninterrupted night's sleep. Give these strategies a try and come back and share your experience in the comments below. Which one made the biggest difference for you? The sitting technique, the standing technique, or even the sleeping technique? I'd love to hear which worked best for you. So leave a comment and let me know. Be sure to like and share this video if you found value in it. Also, go ahead and subscribe right now if you want to learn more ways to enjoy a life free from pain, filled with health and joy. The next video you should watch will show you how to tell the difference between SI joint dysfunction, sciatica, and lumbar disc bulge. Go watch this video next.